All right, guys, I took a few weeks off to get my mind, body, and soul right because balancing it all can be taxing. Work, family, running businesses, outside of work, protecting your personal space, and for some of us, still navigating probationary responsibilities. Plus, the community work I do with Marriott Inc. It sometimes we just got to realize that the most disciplined move is to step back so you can step forward and stronger. Now, you notice the new backdrop of the show has changed. We're evolving, and I'm also excited for what's next. Speaking of, our brother Christopher Willars has some big news brewing. From what I've seen on his socials, a new book is dropping very soon. More on that when it's official. But for now, I'm glad to be back with you. And I want to go ahead and get over into this episode because this episode is about health. It's about being able to take care of yourself, right? Health is actually freedom work. Wherein you're listening to me right now, I want you to hear this clearly. My health is part of my freedom plan. So if you just came home or you love someone who did, this episode is about taking health seriously in a way that's simple, doable, and built for real life. Now, I'm not here to throw medical jargon at you. I'm just here to give you a roadmap you can start today. One step, one call, one appointment. That's the win. Now, I know the reality is that a lot of us come home with burdens no one can see. A lot of people come home with high blood pressure, right? Don't even know they got it. Um, High blood pressure that was never treated right, blood sugar that's been creeping up for years, breathing that's tight every time the weather changes, a mind that's heavy, restless, and anxious, old injuries, new stress, and sometimes a quiet fight with substances that, we don't talk about out loud. All right. None of that means we're broken. It just means our care has been broken. So today, I'm putting that power back in our hands. Now, here's what I'm going to do. What I'm going to do is I'll paint a picture first of what health looks like for most people coming out, state and federal, right? Not to label us, but to point us toward what actually works. Then I'll talk through the barriers and the myths. No insurance, maybe closed doors, maybe there's a little bit of judgment and confusion. And I'll show you exactly how to move through them. After that, I'm going to make the case for knowing your story, your family health history, and your personal health history. Because when your doctor knows your background, they can catch things early, treat smarter, and keep you stronger. And at the end, I'll give you a 7-day and 30-day game plan. You can start right now, whether you have insurance or not. Okay. So without any further ado, guys, welcome back to the Conviction Fiction. All right, welcome back to the Conviction Fiction. I'm your host, Antoine Rivers. Now, let me go ahead and set the tone for this episode. I'm not chasing perfection. I'm trying to build consistency. I'm not trying to fix everything by Friday. I'm into the business of stacking small wins until they add up to a new normal. Okay. Maybe that starts with a phone call to a clinic that sees people on a sliding scale. Maybe it's asking for an HIV or hepatitis C test. Maybe it's just writing down my medications, my allergies, so I stop guessing when I go to the pharmacy. Maybe it's texting 988 because the night got a little bit too heavy for me. I need help staying safe in my mental and physical state. So, whatever my next step is, I'm encouraging you guys to do like I do and take that step today. One more thing before we start rolling on with the show, because this show isn't a substitute for professional medical advice. It's basically a guide to get you into care that respects you. You deserve a primary care home, right? You deserve preventative screenings. You deserve evidence-based treatment for mental health and recovery. And more than that, you deserve to be treated with dignity every single time you walk into a clinic or a hospital. Now, let's get into some facts, right? We know that there are barriers, the history, and then there's the plan. Because, like I said in the beginning of this opening up for this show, health is freedom work, and I'm ready to work it. I'm telling you, I'm so ready to work it because um, here are some facts that really are startling, right? You can't address health issues unless you know the facts. Let's talk about the numbers and what they say. All right, first of all, these numbers always point us toward action, right? National surveys of people in prison, state and federal, both show that there's a pattern, a real specific pattern. Around 4 in 10 folks report a chronic medical condition. And what that means is like for every 10 people, 4 of them will report whether it's high blood pressure, um, whether it's um, diabetes, right? Roughly 4 out of 10 people will say they have some type of chronic issue. That tells me 2 things. First, I'm not alone. Second, blood pressure checks and follow-ups need to be on my short list because this should not be on my someday list. I'm going to go check on this someday. Mental health shows the same pattern. Among people in state prisons, serious psychological distress in the past month shows up at rates meaningfully higher than what we see in federal facilities. And both are higher than the general public, right? So prison does have an effect on people's mental health, right? A big chunk of people report a history of mental health concerns. Like they don't mind telling you that they feel overwhelmed or anxious or depressed or on edge after coming home. It's not a personal failure, it's very common and it's treatable. That's why I make space in my plan for real mental health care. That's like either through counseling, um, medications, even when I need it, and support. I don't have to white knuckle through by myself, right? I do go to counseling. I do have a support system, right? Um, some nights I've taken melatonin just to go to sleep, right? Just to get through it. Like substance use disorders are a whole nother thing, though, right? They are part of this story too. Nearly half of people in state systems and about a third in the federal system meet the criteria for having a real substance use disorder. They've been diagnosed with substance use disorder. That's not a moral sentence. That's a medical condition, guys. Substance abuse, substance use disorder is a medical condition with proven treatments, including medications for opioid use disorder like methadone and structured therapies that help craving shrink and stability grow. If recovery is part of my path, then treatment belongs on my calendar, just like a job interview or probation checking, right? I need to have those in my life. Now, infectious diseases, they are a real risk and it's actionable. Hepatitis C rates behind the wall are many times higher than in the general population. That matters because this surprises a lot of people. They're like, how they get hepatitis C? Well, there are tattoo guns and needles and all kinds of other stuff going on in prison. And it's now unknown, for many of us that hepatitis C is curable with pills. I want to be screened if I haven't been, right? You should want to be screened if you haven't been screened for hepatitis C and treated if I need it. The same way HIV, get tested, know your status. And if I'm negative or if you're negative but at risk, ask about prevention options. And I can't ignore the danger window just after overdose risk spike in that first stretch of freedom. Let me say that again. Overdose risk, they spike in that first stretch of freedom. That's why I talk with my provider about medications for opioid use disorder, if that's relevant to me, and about a safety plan that keeps me alive and moving forward. When supports are in place, real appointments, an active pharmacy, people I can call, the risk drops and my odds of staying free and healthy go. None of these numbers define who I am. They define where good medicine should start, like blood pressure, diabetes, cholesterol checks. All of that is vitally important. hepatitis C and HIV screening, mental health evaluation with kindness and skill, recovery options that meet me where I am. This is a blueprint, not a label. Because if you were to admit, if you're a person on this show that listen to me, you know I'm about reentry. And the best way to stay free or the best way to avoid recidivism is to have a plan. And that plan goes further than just getting a job. It goes further than finding employment. It just goes further than trying to get back with your baby mama. It requires screening. It requires a health plan. Okay. So it's not a call out to nobody, but you got to have some type of plan because there are too many barriers and myths and things that we all have to go through in order to get to where we have a plan, especially when it comes to our health, and that's mental and physical health. I'm gonna say it out loud now. The stuff that trips us up and how I push past those things. Now, barrier number one: I don't have insurance, so I can't see a doctor. Here's how I move, right? I call the community health center, and I say, hey, I'm a new patient. I'm applying for coverage, and I need a sliding scale visit. I need a little visit now because these clinics are designed to serve people regardless of their ability to play, right? They if you don't have any money or have any health insurance, they are, some of them are government funded, some of them are privately funded, but they give you health care if you don't have any money. They do primary care, mental health, dental, and more. They know the paperwork dance. They can help me or help you apply for Medicaid or marketplace coverage to start care today, right? So that's barrier number one. That's out the way. I don't have health insurance. So what? There are places out there, community health centers, that will give you or help you get health insurance, right? Barrier number two: my Medicaid got cut off. Now, here's the truth. Many states have suspended Medicaid during incarceration and can reactivate it at release. So there are policies that are expanding to connect people to care before and after they come home. So if I ask my reentry staff, probation, or the clinic, can we get my Medicaid turned back on before I get out of prison or before I get out of this halfway house, then that's a win-win, right? That's, they can probably help me get that stuff going before I am released back into society. This is some of the stuff that should be talked about in those halfway houses, or some of the conversations that should be had in pre-release. Okay. Now, if I'm not eligible, I'll ask about marketplace plans with big subsidies like Aetna or, Cigna, or I can stay on the sliding scale until I get my feet up under me, you know? So there are options. Now, barrier three, I might need help for mental health or cravings. We're talking about that substance abuse, right? Now you can call or text anytime for emotional distress, suicidal thoughts, or substance use crisis to 988. It's free and confidential. So if I'm looking for treatment options, I use the National Treatment Locator online to find programs, and they will be in the show notes today. And I ask specifically about medications for, say, I'm on opioids, or if sobriety, when I need sobriety away from alcohol, right? I don't white knuckle this alone. I let trained people help me to stabilize. I'm getting out into society. I need to be stable in my mental if I'm going to succeed out here. I'm not going to fall back onto my survival techniques and find myself back up in prison. It's very important for me to have a support staff around me. And then, more than that, have the courage within myself to make a plan if I want to stay out. Another barrier that comes up is that clinics will sometimes judge you because of your record. Some might, many won't, but community health centers are trained in trauma-informed care. So if I get treated poorly, I can switch. I can bring a trusted person to the first visit with me if that helps me speak up. Most of us, when we get out, we don't even know how to talk to people. We know how to talk to our bunkie. We know how to talk to our cellie. We know how to talk to people on the yard, but we don't know how to talk to people, the citizens, right? Because what I found out is like a lot of times people um, think that people on the outside are asking for favors. Like when they get out, I'm asking for a favor. Um, or we feel like they think that we're looking for entitlement. I get that a lot of times on the show. People are like, oh, he's on there again talking about how he needs help. He needs help. No, I'm not saying I need help. The only reason I need help is because I recognize that I need help. That I've been in a situation that many of the listeners who's never been in a situation can't understand, right? Or they won't ever understand because they've never been there, right? Family members, they suffer, they know what it's like to deal with someone that has been incarcerated. So we're not asking for favors or entitlement. This is our support community, right? This is our support community. So, I mean, if it's not your cup of tea, you don't understand it, then I encourage you to try to understand without making judgments. That's what the show is all about, changing the narrative as we change lives. Now, as a human being, I think I am entitled to healthcare. Okay. And just as a human, looking out for another human. Now, I know a lot of politics play into this, wherein some people say, well, you don't deserve healthcare. You need to pay for it. Right. But if we live in a society, and I think we're getting very close to that, to a society where you have to pay to live, then that says a lot about our humanity as a whole. Now, another barrier that many of us face is that, we think, I feel fine. There's nothing wrong with me. Why should I get checked? Well, preventive care saves future me from emergencies. Like I asked for the basics, the blood pressure, blood sugar, cholesterol, a certain age or even a certain race you might want to get, colon or kidneys, you want to get those checked. You know what I'm saying? So it's very important that you are on preventive care. I ask about screenings that fit my age and risk. I did a colostomy. Of course, I got knocked out, though. I went up onto it and I woke up and I was like, oh, what happened? But I did that to make sure that on the inside of me, even though I felt fine, I want to make sure there wasn't nothing underlying going on. I did find out that my cholesterol was a little high. So I started cutting back on certain things, right? Started cutting back on fatty foods, you know. Um, and if I'd never been tested for it, if I had never been tested for hepatitis C or HIV, I would definitely add that to the list. You never been tested for hepatitis C or HIV, add that to your list too. And ask to review like vaccines, like the tetanus booster, flu shots, hepatitis A and B if needed. If it's been years, then that's okay, man. Clinics can catch you up. Now, barrier, I think the sixth barrier that I had came up with, I was sitting around like, man, give me ideas. I need ideas for this show, right? Because we know that there are barriers when it comes to healthcare. Some certain people like me, we just don't like going to the hospital anyway because we think we're gonna hear something bad. Then I know a friend of mine, he don't go to the hospital because he don't have any health insurance. He gonna have to pay for it out of pocket, and he don't have money like that because he paying child support. You know, so many of us run into barrier six where it's like I don't know where to start. I don't even know where to begin, but I know I need help, but I don't. It's just too big of a task to overcome, right? Now I start with one task and a script. I write it down and I read it on the phone. Hey, I'm a new patient. I recently turned home and I'm applying for coverage. I'm gonna need a primary care appointment as soon as possible because I want screening labs, I want a vaccine review, and a referral for counseling. I want to stay home. Then I asked them to confirm the date, the time, what to bring, and which pharmacy they'll send my medications to. Is it somewhere on the bus line? Maybe I don't have transport. Is it walking distance? Maybe I'm not on the bus line, right? And I asked for a second appointment on the books before I even hang up, right? I asked for that second one, like, okay, we're gonna go do this one and screen. Well, now you're gonna screen me, you're gonna check all this stuff. When would a follow-up appointment so we can discuss things that I could do in order to get these numbers down if they are elevated? Here's my pro move to everyone. Make a simple health go bag, right? Just a bag of stuff, a folder or note on your phone with your ID, insurance card, or the application for your insurance card, a medications list with the doses, how many milligrams in it if you're taking meds, any allergies that you have, or any past diagnosis where a doctor said, well, you have high blood pressure, and those numbers, and then the names of your clinic, the counselor, or the pharmacy that you go to. That little notation or that health bag saves time. It lowers your stress because it stops me from repeating the same story 10 different times or saying the same story with different numbers. At least I had the facts right here about my health on my phone or easily accessible to me, right? Easily accessible to me. Now, now we're going to get into the part about knowing your story, because family history, believe it or not, plays a big part in your health playbook. Right now, what are the barriers for that? What are the barriers for that? If I want the right care at the right time, I bring my story to the visit, family and personal. Family health history is a cheat code for prevention. If my father had heart attacks in his 40s, my provider may screen me earlier and more often. My sister had colon cancer young, then that shifts my screening timeline. If high blood pressure or diabetes runs in the family, now that changes how aggressive we are about checks and lifestyle tweaks right now, not later. Now, um, here's how I gather. I make a short list of relatives, people that I know, parents, they still around, siblings, children, cousins, and ask about big conditions like, was that heart disease, stroke? Anybody ever had diabetes, high blood pressure, high cholesterol, kidney disease? I mean, any of that stuff, cancers. And I want to know like the age that they were found, were there any serious mental illnesses and substance use disorders? And if we were to think about it, we know a lot of this stuff. Yeah, we could say, well, hey, yeah, Uncle Jeff died a few years ago of colon cancer. How old was Uncle Jeff? Right? I make a note of that because that's my mother's brother, my uncle, and he died of colon cancer at say 56 years old. Right? That's family history. I don't need a perfect family tree to help my provider, right? Or help the healthcare professional that's helping me, right? If you know your auntie was on crack or your auntie was on drugs and she had been using drugs for as long as you can remember, you can go think back, say, oh yeah, my auntie, she I was 13. So when I was 13, she had to been 28 and she was on drugs heavy. So that's substance abuse in your family. Even partial information is powerful. I write down the ages and diagnoses if I can, or at least early or later in life if dates are fuzzy. So I was like, early in life, I think my mom was on substances, or my mom used to drink a lot. Or later in life, my dad he used to take diabetic shots. He used to take diabetes shots. You know what I'm saying? Insulin shots, right? Later on in life, does just know. Then I can collect my personal history. I list every medicine that I've ever taken, even the over-the-counter stuff. I include the dose, like the milligrams, how strong it is, how often, what it was for. I know if there were any allergies that I may have been affected by, and what happens when I had a reaction to an allergy. Um, I write down surgeries. Many of us have had surgeries in the past, right? How if we ever stayed in the hospital, and any big diagnosis like asthma, if you've been ever diagnosed with COPD, hepatitis C, or depression, or even PTSD. If I've ever injected drugs, had tattoos, or in unregulated settings like prison, or lived in close quarters where TB or tuberculosis exposure might happen, I let my provider know, and you should let your provider know. That's not confession. It's context in order to make you better or at least know the risk that you are up under. It helps them order the right test and keeps you safer. So that's very important to know your history, man. And bring some questions. Literally bring questions. Write them on a piece of paper or put them in your phone. What screenings do I need based on my age and my family history? We check for Hep C, right? What's my blood pressure today? And what's our plan if it's high? Do I qualify for a statin to protect my heart, like for cholesterol? What vaccines am I missing, like tetanus, flu, even COVID? Right? Can we talk about sleep, stress, and cravings when it comes to substance abuse care? I try to ask those clear questions. I promise you, if you ask clear questions, you're going to get clear care. And lastly, you got to make the record work for you. Ask for a printout or a portal login so you can log in and see those results and keep your lab results so that you can compare them the next time, right? Confirm with your pharmacy, like refills don't just mysteriously vanish. I always schedule a follow up before I leave the building when I go to the doctor. Like, I look for one small habit I can add this week, whether it's like taking a walk, drinking a little bit more water, fewer sugary drinks, maybe a normal bedtime, because health is a long game, guys. And these little moves multiply the impact of everything else that you're going to be doing, right? And that includes staying out of prison. Now, here's a 7-day or 30-day game plan for you guys. This is the part where I stop talking and I start doing. But you should stop listening and start doing. Now, I call this my 7-day and 30-day game plan, right? But you can adopt it as well. If you do, please put it in the comments, the changes that you've made or the accomplishments, the small steps that you've done, and their results. Because today, if I feel unsafe or overwhelmed, if the thoughts are dark or the cravings are strong, I can call or text 988 right now. I'm not alone and I don't have to navigate tonight by myself. So if I need treatment options, I use the national treatment locator that you'll find down in the bottom of these show notes and ask for programs that fit my schedule and transportation needs. If overdose risk is a part of your story, ask about not medications for opioid use disorder. If you want to live, you want to win. So make it a full stop. Now, today, you can look up a community health center near you. Call and say, I'm a new patient. I'm applying for the coverage. I need that sliding scale. Ask them to check your vaccine records if they have them. And before you hang up, schedule that second appointment 2 to 4 weeks later, because that's where we are going to have you review those plans. So within 7 days, I can show up to this appointment. I bring everything that I know, my questions. I ask for my blood pressure. They take it. They take my blood sugar. They have to, run blood tests. And even if I haven't been tested for a Hep C or HIV before I got out, I want to request it, right? I want to confirm. You want to confirm where your pharmacy is and ask for refills on time. If counseling or recovery support is part of your plan, then go once. Then go at once. Even if you're not even sure yet, just go. Give yourself a chance to feel the difference. Now, within 30 days, I go to that second appointment. This is where we're going to review the lab, right? If blood pressure was high, I will going to leave that office with a clear plan of action, maybe even a prescription. If my blood sugar, cholesterol need work, I'll talk about the meds and food and movement I can actually do. And if you need those vaccines, start getting them. Start getting them started. Set reminders on your phone for your meds and follow-ups, right? But more importantly, keep walking. Keep drinking water. Keep sleeping on time. Again, adequate sleep. And more importantly, man, talk honestly and openly about how you are doing. Okay. Now, by 90 days, you should have a primary care home, right? You have at least one preventative screening checked off. You have your next appointment on the calendar. You got your health go bag with all your medication, allergies, and all that stuff. And now At this point, this is where my mindset became steady. Now, I'm not chasing perfection. I'm just stacking those consistent steps so that when I miss a step, I can start again tomorrow. My health is freedom work, and I'm committed to it. Now, let me close with this. Now, I didn't come this far to let untreated blood pressure, some silent infection, or unspoken pain write my future. I came this far to live fully and long. Now, if you're with me, take one step today, make the call, book the visit, ask the questions. Your body, your mind, and your future, you're worth the work. Trust me. All right, we're going to change the narrative on what it's like to be a convict living in society. That's what the conviction fiction is about. See you guys next week.